Hi everyone, welcome back to my channel. For those who are new here, I'm Dr. Tristy Edwards, and today we're going to talk about a very common topic that is a huge bother to a lot of persons. Before we get into the topic, let's talk a little bit about shaving. So shaving is a very commonly practiced method of hair removal, and it's very quick, it's easy. Most people have access to a razor of some sort. And it's very easy to get rid of a lot of hair over a large body surface area in a short amount of time. Now, as you know, with any process that is so smooth sailing and easy, it's almost too good to be true. Of course, there's going to be some complication, and that's what we're going to get into. So, after shaving, you may have itchiness, redness, razor burn, and just that uncomfortable feeling. But the biggest culprit that comes about after shaving, waxing, plucking, and other forms of hair removal is the dreaded ingrown hair bumps. The medical term for hair bumps that come about due to shaving, waxing, and other methods of hair removal is pseudofolliculitisbarbae. Why do these pesky bumps come about, you may ask? Well, why don't I show you? It can occur in two main ways. After the hair grows out of the skin, it may make a U-turn and puncture the skin next to it. The other way is due to the hair failing to grow above the skin level and curling inwards instead. So what results from this process is usually red or purplish or skin-colored bumps that are very irritated, and they occur right around the hair follicle. Some of them may actually have little pockets of pus, and they tend to be quite itchy. Now, if you're someone who's prone to getting keloid scars, this may become problematic because sometimes these bumps can transform into keloid scars, and another complication is that they tend to leave behind very dark spots that just aren't aesthetically pleasing. In my practice, I tend to see ingrown hairs a lot around the jawline, under the neck in males, and also in some females who have excessive hair growth in those regions, a condition called hirsutism. I also tend to see it a lot in the bikini area, so in the bikini line and on the mons pubis. Let's look into the things that you can do at home to help to treat ingrown hair bumps or prevent them from popping up. Avoid super close shaving. So those razors that have a lot of blades, 3 blades, even up to 4 blades that give you that nice close shave, those aren't a great idea. When the hair is just right above the level of the skin or right under the level of the skin, the chances of it not making its way out or curving back to puncture the skin is a lot higher. So a close shave puts you at a higher risk of getting ingrown hair bumps. Another thing you can do is use chemical exfoliants. So salicylic acid, lactic acid, glycolic acid, mandelic acid, whether in the form of serums, moisturizers, or toners, using those exfoliating acids in the areas will help to prevent excess dead skin cells from trapping the hair on its way out. I did mention chemical exfoliants in the form of a moisturizer. However, even if you're not using something like this every day, you should keep the area well hydrated and moisturized. The skin should always be as smooth and supple as possible. Use a warm rag to the area before shaving. Warm water will actually elongate the hair shaft and allow for ease of shaving. Also, don't forget your shaving cream. Ensure your razor is clean and sharp. You don't want to be using a dull razor anywhere on your body, as that will just tug on the skin and irritate it and give you jagged edges to the hair shaft. Do not stretch your skin while shaving, and always try to shave in the direction of experience irritation and inflammation to the skin, you can actually pick up some hydrocortisone cream over the counter for its anti-inflammatory benefit. Last but not least, always remember that your acne medications can also be used for pseudofolliculitisbarbae, aka PFB, aka ingrown hair bumps. So your benzoyl peroxide, your salicylic acid, your retinoids, and of course we mentioned all the other acids. They can actually be used to treat the bump and release the hair. If you have hyperpigmentation left back from the hair bumps, or you have concurrent hyperpigmentation with the bumps, then you may want to seek the care of a dermatologist. Also, if the situation is just completely out of control, I would highly suggest seeing a dermatologist to avoid scarring and other complications. You may need oral treatment and more extensive management. Thank you all for watching this video. I hope you found some of the tips helpful and you'll be able to incorporate some of them into your everyday regimen. Don't forget to like, share, subscribe, and I'll see you in the next one.